wash my hands. Hello, my name is Nicole. I'll be your nurse practitioner today. I'll be doing a head-to-toe assessment on you. Do you have any questions today?
No.
Okay. The first thing I'm going to do is I'm going to start by inspecting. So we're inspecting the skin, and we're looking for any temperature, color, moisture, texture, any edema, any nevi, any rashes, and any discolorations that might be present. So we're going to just fully inspect the skin, and then we're going to start with the head and hair. Do you mind taking your scarf off, ma'am? Very good. So we're looking at the distribution of hair. We're making sure everything looks nice and even. We're also kind of feeling around the scalp for any lumps, bumps, anything that shouldn't be there, any abnormalities. You can go ahead and look up. I also want to take a look at your nails. We're looking at the nails for any clubbing. We are checking is the circulation as well, and she's got good circulation there. The next thing I'm going to do is we are going to just check your sinuses. So I am going to just check the frontal sinuses with some gentle pressure, the ethmoid sinuses, and the maxillary sinuses. Any pain?
No.
Okay, we're also going to be looking at the eyes to include the eyebrows, the lashes, the lids, checking the lacrimal glands. And I'm also going to do some gentle pressure around the orbital area, checking for any abnormalities, any tenderness, and any pain there.
No.
Very good. I'm going to just check the sclera and the conjunctiva of the eyes. I'm going to have you look down for me. Very good. And look up. Very good. Everything looks good there. And then once we've done that, I'm going to go ahead and check the temporomandibular joint, which is the TMJ, and it's here. Go ahead and open and close your mouth for me. Good. We're checking for any popping, any clicking, and I don't feel any of that. We're also looking for good alignment of the jaw. Next, going to check the temporal arteries, and we're trying to feel if there's any pulsations, any bounding that's there, any protrusions, and everything feels good. I'm also going to just listen to those arteries with my stethoscope. Okay. Very good. Okay. So now we're going to move down. I'm looking at the jugular veins. We're looking for any distension, any pulsations. I don't see any here. Don't see any here. I'm going to palpate the area as well. Very good. And I'm going to listen as well with the stethoscope. Okay, we're going to listen to the other side. Okay. I'm also going to be looking at the neck, so I'm also going to just inspect the neck also. So again, we're looking for any changes in the skin, so texture, turgor, color, moisture that may be present, any edema, any nevi, any lesions, any rashes. And I don't see any there. Can you scoot forward a little bit for me? I'm going to come from behind the patient, and I'm actually going to be just palpating the thyroid, making sure I don't feel any new or enlarged nodules, and I don't feel anything there that's abnormal, excuse me. Go ahead and swallow for me. Okay, and that's good. Glides over nicely. You can scoot back. Very good. The next thing I'm going to do is I'm just going to check the external nose. So looking at the nose, we're also, again, looking for any abnormalities, any asymmetry, any wounds, any lesions, any nevi, swelling, redness, drainage. Don't see any here. I'm going to have you tilt your head back a little bit. I'm going to pull the bridge of your nose up. We're going to look inside each nair, and we're looking to make sure the mucosa is nice and pink and lubricated, which it is. We're also looking for any drainage, any foreign bodies, and I don't see anything there. We're looking at the septum to make sure it's nice and aligned, and we're also looking at the turbinates to make sure that there's no bogginess there in the turbinates. We're going to move down to your mouth. So we're going to start with the external mouth. We're just looking again for symmetry, making sure everything looks symmetrical, looking for any lesions or wounds, any moles that shouldn't be there. We're also checking for moisture, any edema, and things like dryness with chapped lips. And everything looks good. I'm gonna have you open your mouth for me. You're gonna say ah, stick your tongue out, very good. We're looking at the tonsils, we're looking at the airway, the back of the mouth. We're also looking at the roof of the mouth and the buccal mucosa, which looks good. While we're in there, we're also checking dentation. We're also looking at the tongue to make sure the tongue looks good and there's no wounds or issues with the tongue, no scalloping of the tongue edges. And so far, that looks good. The next thing we're going to do is we're going to move on to your thoracic area or your chest. So ordinarily the patient would be gowned for this, but for the sake of this exam, she will remain with clothes. So we're going to inspect first. So we're going to inspect the interior portion of the chest, as well as the posterior aspect and lateral aspects. So I'm going to just lift your arm. And again, we're looking at the skin. We're looking to see if anything stands out to us, if we're noticing any deformities, any abnormalities, checking the skin for temperature, color, texture, turgor, as well as any nevi, any rashes, any wounds, and everything looks good there. The next thing we're going to do is we're just going to palpate. So I'm going to go ahead and palpate the front, so the interior portion of the chest. I'm going to do lateral, and we're also going to do posterior. And do you have any tenderness anywhere in there?
No.
Okay, very good. When I'm looking at the chest, I'm also looking to make sure the expansion of the chest is normal, to make sure it is even on both sides. There's no area where it's larger or different. And I'm also looking to see if any accessory muscles are being used or any retractions are there. And I do not see any as of yet. So the next thing we're going to do is we're just going to go ahead and percuss. So I'm going to start here and we're going to kind of percuss at the top. And laterally. Very good. And then if you can just angle yourself this way a little bit. Perfect. I'm going to now check posteriorly. Okay, very good. You can come right back around. That's great. The next thing we're going to do is we're going to go ahead and just listen to your lung fields. So I'm going to actually, I'll start from the front and we'll go here. So this is cold. When you feel my stethoscope touch you, I'm going to have you take a nice deep breath in and out. Very good. Okay, and if you could turn for me, we'll listen to the back of you. Again, deep in and out. Okay, one more. Okay, very good. Okay, now we're going to move on to your heart. So we're going to go ahead and start by just inspecting the precordium area. And so we're looking at that area for those same things. So again, any changes in skin texture, color, rash, any nevi or moles that are there, any edema, any moisture that's there, and everything looks fine there. So next we're going to go ahead and palpate the area. Any pain in this area?
No.
Very good. Okay. Now we're going to go ahead and listen. Excuse me. Excuse me. We're going to go ahead and listen with the stethoscope. We're going to start with the bell and the diaphragm, and then we're going to listen with the bell. We're going to listen to specific areas. So the right second intercostal space, we're going to do aortic area. The left second intercostal, we're going to do pulmonic. The third intercostal space on the left side, we're going to do Erb's point. The fourth, we're going to do tricuspid. And then the fifth, midclavicular, is going to be your mitral valve, okay? So we're going to start on the right. Just relax. Okay, now with the bell, we are listening in the seated position, as murmurs can be heard a little bit better in this position versus supine. Okay, I'm going to have you go ahead and lay down for me. We're going to check you just laying down. We're going to do the very same thing, just in a laid down position, okay? Very good. And we're also just going to look at the carotid. Again, I'm going to check a pulse. Check a pulse. We're also looking for distension and things like that. We're feeling for thrills, which I don't feel. And I'm going to listen for a bruit on both sides. Next, we're going to just go ahead and we're going to check your pulses. You can relax. We're going to start with a radial pulse. Okay, so we're going to just start on the right hand side first. So radial pulse. Then we're going to do a brachial pulse. Very good. We're going to do uncross your legs. We're going to do a popliteal pulse. Very good. We're going to do a posterior tibial pulse. We're going to do a dorsalis pedis pulse. Okay, now we're just going to move to the left-hand side with the same one. So just dorsalis pedis, posterior tibial, popliteal, radial, and brachial. Very good. Now we're going to go ahead and move to the abdomen. Do you mind lifting up your shirt for me? Very good. And you're comfortable? Mm-hmm. Very good. So the first thing we're going to do is we're just going to inspect the abdomen. We're looking at the skin that's there. We're checking for those same things. So color, texture, turgor. We're looking for any rashes, any nevi, any bruises, any injuries, anything that shouldn't be there. That's what we're looking for, okay? I don't see anything there. So we're going to go ahead and move on to auscultating. I'm going to start just by auscultating all 4 quadrants. Sorry. Okay, I'm also going to do the aorta here. Very good. I'm going to do the iliac arteries. Okay, I'm going to do the femoral artery. Also on the left side. And we're going to do the renal arteries. Okay. Now we're just going to go ahead and percuss. So I'm just going to do all 4 quadrants. Very good. The next thing we're going to check is we're going to check for your liver, which is on the right hand side. We're going to look at the midclavicular line. We're going to start here. And we're checking for areas of tympany or dullness to demarcate where the liver is going to be. So it feels like the top is here, and we're going to go from the bottom, and it changes here. So it's about this much space, so it should be anywhere between 6 and 12 centimeters for a normal liver, and that is fine. We're going to go ahead and check for the spleen on the left-hand side. So we're going to go down to the 10th intercostal space. We're going to check now. There you go. That's tympanic. I'm going to go ahead and have you take a nice deep breath and hold it in. Okay. And there's no changes there. If there was a change and you heard some dullness, it might suggest some splenic enlargement, which could mean she needs imaging, or perhaps it's she may have an emergency that needs to be taken care of surgically. So after we do that, I'm going to go ahead and palpate. So I'm just going to start with light palpation. Are you having any pain?
No.
Any pain?
No.
I'm going to go a little deeper. I'm just going to make sure we're feeling all of the things down in there. Any pain?
No.
Any pain?
No.
Any pain?
Mm-mm.
Okay. Now we're going to check for some rebound tenderness. So I'm going to come over here on the left-hand side. I'm going to press in. Any pain?
No.
Okay. Try on the right. Any pain?
Mm-mm.
Very good. Now I want to check your kidney area. So I'm going to have you roll towards this wall over here. If you could, just on your side. Okay, so I'm going to check the back here. And are you having any pain there?
No.
Okay, very good. I'm going to have you turn towards me. We're going to do the same thing. Okay. Any pain there?
No.
Okay, you can go ahead and lay back on your back. Okay, we're going to also just feel the aortic area. We're going to make sure we're not feeling any pulsing, any bounding, any protrusions in this area. And I don't feel any. Put this down. We'll then go ahead and feel the femoral areas. We're feeling for any lymph nodes, any enlargements, any tenderness, any very firm lymph nodes, anything that shouldn't be there. And I don't feel anything on either side. We're going to palpate the femoral artery, first on the right, then on the left. Very good. And all of that sounds normal. The next thing that we would move to do is we would move to do the GU exam. And for the sake of this assessment, we're not going to be actually performing that assessment. However, since she is of age, we would normally start with the breast exam, and then we would do a pap smear, and then we would do a pelvic exam, okay? Now we're going to go ahead and just do a musculoskeletal assessment. If you could come swing your legs around and just sit. We're just going to take a look at your overall structure. We're going to make sure we don't see any obvious deformities with your joints. I do see that you're hyperextending in your elbows. However, other than that, I don't see any obvious deformities. The next thing we're going to do is we are going to just inspect the skin all over. And again, we're looking for color changes, texture, turgor, swelling, moisture, any bruises, any injuries, any nevi, and I don't see any. We're going to start with your neck. So with your neck, we're going to have you do some exercises, okay? We're going to check flexion, so I'm going to have you bring your chin to your chest. Very good, that's flexion. I'm going to have you do extension, so I'm going to have you put your head, there you go, very good, extension. Now you can rest your head in the normal position, a neutral position. I'm going to have you put your left ear to your left shoulder. We're going to check lateral movement. Good. Back to neutral. Right ear to right shoulder for lateral movement there. Very good. Now I'm going to have you just kind of roll your neck in a circle to check for rotation. Very good. So you can relax there. We're going to move on to your shoulders. Okay, so in your shoulders, we're going to check for adduction. So I'm going to have you bring your arm away from your body for adduction. You can start on the left. Abduction, we're going to bring it towards you. We're going to do internal rotation and external rotation for me. Very good. And we're going to repeat the same on the right. So adduction, abduction, internal rotation for me, external rotation. Very good. Okay, from there, we're going to move to your elbows. So I'm going to have you just relax. We're going to have you do flexion. So arm up. Very good. Extension back down. Very good. We're going to have you do supination on this side. So I'm going to have you have your hands towards the ceiling. Very good. And pronation, you're going to bring them down. Very good. We're going to do the same thing on this side. So flexion up, extension down, supination, pronation. Very good. We're going to go ahead and look at your wrist. Okay, we're going to do the same thing. So flexion up, so you're going to pull your wrist up to your head. Okay, very good. Extension down. Very good. We're going to do radial inversion. So you're going to go this way, and ulnar eversion that way. Very good. And we're going to repeat the same on this side. So flexion, extension, radial inversion, and ulnar eversion. Very good. We're going to look at your hands. I'm going to look at your fingers, and we're going to have you do flexion. Very good. Extension. And then we're going to have you do adduction. So you're going to split your fingers out. And abduction, you're going to bring them in. Very good. Same thing over here. So extension, flexion, adduction, abduction. Very good. Okay. If you could stand, we're going to look at your, while you're standing, let me look at your spine. So when we're looking at the spine, we're just checking to do a visual inspection, making sure everything is in line. Everything looks fine. We are just going to check down as well. Okay, very good. If you can step away from the bed, we're going to have you try to touch your toes. This is going to do flexion. While she's in flexion, we're still going to check the alignment of the spine to make sure there's nothing like scoliosis there. You can go ahead and stand. And we're looking also for kyphosis or lordosis as an abnormal curvature in the upper spine. We're going to have you do some extension. So you're going to extend your back. Very good. Okay, you're very extendable. Very good. All right. The next thing we're going to do is we're going to have you do some lateral movements. So you're just going to put your hands on your hips. You're going to move laterally to your right side, back to the middle, and laterally to your left side. Very good. We're going to have you do a little bit of rotation on your back as well. Okay. Very good. All right. You can relax there. You can turn towards me here. We're going to look at your hips. So we're going to start with flexion of your hips. We can start on the left-hand side. You're going to bring your knee up for flexion for me. Very good. You can relax down. We're going to pull our hip back for extension. Very good. And then you're going to relax back to the middle. You're going to do adduction out. Very good. Abduction in. Very good. And then we're going to do external rotation and then internal rotation. Very good. We're going to repeat on the opposite side. So we're going to do flexion. Very good. Extension. Very good. Adduction. Abduction. External rotation. Internal rotation. Very good. Go ahead and have a seat for me. We're going to look at your knees now. I'm going to have you do flexion with your knees. So go ahead, or excuse me, extension with your knees. Extend out. Flexion back down. As over here. Extend. Flexion. Okay, we're going to look at your ankles. So we're going to have you do dorsiflexion. So you're going to point your toes down. Point them up to the sky. Dorsiflexion. Plantar flexion is down. Very good. And very good. You can relax. We're going to come back over here. We're going to do the same thing. So dorsiflexion towards your head. Plantar flexion towards your the floor. Very good. That looks excellent. While you're sitting here, I'm just going to test your strength. So go ahead and try to pull your shoulders up to the ceiling. Oh, goodness, you're strong. Okay, very good. Go ahead and put your arms up like this for me. I'm going to have you push me away from you. Very good. Pull me towards you. Very good. All right. I'm going to have you just put this knee up to the ceiling. Very good. I'm going to have you do the same thing over here. Very good. You're strong. All right. Let me see the feet. I'm going to have you go ahead and pull towards your head for me. Good. And push the gas. Very good. Strengthen here again. So go ahead and pull towards your head. Push the gas.